Hi guys, today's case is of a patient experiencing pain in the upper left back region. On radiographic examination, we found that there was no significant pathology or any lesion associated with the teeth. Even here we can see this is tooth 2-5, and then if I move here, even the endodontically treated tooth 2-6, it exhibited, you can say, healing post-treatment appearance, but there was with the mesiobuccal root exhibiting healing post-treatment appearance with no significant pathology. But we found something interesting within the maxillary sinus. So here, this density is similar to that of air, depicting air level. And here, if I move my cursor, this is density similar to that of fluid. So this is a air fluid level which has been formed here. Moreover, here if I move my cursor, as you can see, there are small air bubbles which are formed within the superior aspect of this fluid level. And so what are these air bubbles? These air bubbles are nothing but just the bacteria which is responsible for causing infection within the sinuses, that is the aerobic and the anaerobic bacteria. The bacteria produces gases, and these gases are responsible for the air bubbles which we can appreciate here. So the features which we have seen, that is the air fluid level, these air bubbles, and they are very characteristic feature of acute sinusitis. Now if I have a look on the walls of sinuses, here if you can see my cursor, the wall here is slightly thickened, that is the lateral wall, and even here the wall is very slightly thickened, but the medial sinus wall is thin and remains intact. So overall the lateral wall, since they are thickened, so maybe this patient had a history of chronic sinusitis, but presently the case is of acute sinusitis because of this air fluid level and the air bubbles which are seen. Now, to have a brief, informative session about sinusitis. So it's just that acute condition comes when the infection is nearly, you can say, less than 4 weeks. And if it lasts for more than 12 weeks or more, then it is a case of chronic sinusitis. And the typical differences, radiographic difference between the two is that in acute, there can be either complete sinus can be filled with the fluid, or just the air fluid level can be seen, but the walls, they will remain thin and intact. But in case of chronic sinusitis, the walls will be very thickened. Why? Because the pressure which is exerted by the gas, that is the one which, and the inflammation which is happening since a long duration, that is responsible for the thickening of the walls in case of chronic sinusitis. So this case now, it needs to be referred further to an ENT specialist for evaluation of frontal sinus, ethmoidal sinus and sphenoidal sinus.